So my name is Dr. Were Andrew. I'm a plastic reconstructive and aesthetic surgeon based in Nairobi. I do practice in Kenyatta National Hospital, and I also do work at Da Vinci Medical Group, where we offer both reconstructive and cosmetic surgery services to our clients. Today we are partnered with Ponea Health to talk about plastic surgery in Kenya. For the ladies, for example, when you do tummy tucks, we normally encourage ladies who maybe if you desire to have a family size of 2 or 3, we encourage you to first finish having the family that you want, and then come and get the tummy tuck done. Because you normally find that because of the fat that accumulates during pregnancy, then the outcome may not be as good if you do it when you still desire to become pregnant. Of course, there are different questions that come up, especially from the mothers, is are you able to do a tummy tuck at the same time when you're doing a cesarean section? So we normally advise that you wait at least 3 to 6 months. It's possible to be done, but you cannot assure of the outcome. And this is because of the risk of infection. So we normally advise the mothers to come maybe 3 months or 6 months later, and we use the same scar, the bikini scar that you got, to be able to provide for you the tummy tuck that you want. But what we encourage is that finish the breastfeeding, take a year or 2. Once the fat is gone, then you can come. And for that, we provide what we call a mommy makeover for most of the ladies. Once they're done what you call procreation or giving birth, then you're able to give you, we can do your boobs, we can do a tummy tuck, we can do for you any kind of thigh lift that you want to be able to restore your look before you had the kid. So plastic surgery is very expensive, but what is more important, and I'd like all of you to take home, is that you have to ensure that it's done by a board qualified plastic surgeon, because you have had instances of safety issues, unfortunately also in our country. But if you properly come for consultation and for follow-up and ensure that you do it in a registered clinic by our medical council, then the outcomes are normally good and you'll be happy with what you want to have. So if you want to desire to have any kind of plastic surgery services, please see us. We are here in Kenya. You don't need to fly out and spend a lot of money, and we're able to give you the kind of body that you desire based on our culture. There's also an aspect of plastic surgery that I think the public need to know, in that the perspective of beauty differs from one particular culture to another. And you find that most of the people who actually go out of the country to have their procedures done always end up coming back to us for a redo of the same procedure. The reason is very simple. How we view beauty in Africa or in Nairobi, and let's say how you view people in Bangkok or people in Turkey or Greece look at beauty is very different. And that's why it's important that we do develop our own plastic surgery standards and guidelines, and we're actually creating more portfolios so that you can be able to come and choose what you want. In fact, if you look around, most of our celebrities of late are now opting to do their surgeries in country because of that particular reason. So it's important when you're choosing also a plastic surgery destination that you actually also consider what is their perspective of beauty, and it's also important that you come and have a consultation with the local plastic surgeons who are equally as good, so that you can be able to get the kind of body that you're going to pay for. Thank you for joining us for this episode. You can book my services through ponea.com, and I hope to see you at Da Vinci Clinic to give you what you want. Thank you.